I hope that most of you have heard of the BMJ and know that we're a leading general medical journal, and that our publication model is a continuous online first, but that we still have the paper version, and but it's a small weekly digest. And I just want to thank MedX so much for inviting me to come along and talk about our patient partnership strategy, which we're really excited about because it's seen us make landmark changes to our internal processes, really in an ambitious effort to influence what's happening in healthcare, to really push partnership in the context of clinical practice, in research, in the design and delivery of services, in policy making, and of course in medical education. But of course it's so easy to talk about patient partnership, but it's really hard to realize it. And we've been trying to push this for, close on 20 years, and I've been very closely involved with this. And we've had a patient editor on our staff part-time for at least that long. And back there in 1999, as you can see on this rather fetching cover, we thought at the time, appropriately sepia tinted for the age, that we talked about in this issue about how doctors really had to change, realize that it was essential to their practice to make this transition from God to guide, and that they had to collaborate with patients if they were going to improve the quality, safety, and the value of healthcare. We talked about, and we continue to talk about, that health depends on a lot more than what doctors do. We've heard this here emphasized, the wide socioeconomic determinants of health and individual patient behavior. And we've also talked about the importance, the crucial importance of the quality of the relationship that doctors forge with patients, and the importance of making shared decisions with them, which takes account of their own preferences and priorities. But I think we have to acknowledge that you can preach the converted, but it's very difficult to win hearts and minds by just saying, do better. So what we thought we'd better do, and we decided this a couple of years ago, is to actually have a bit of an internal revolution. And we were stimulated to do this, so you'll forgive this rather sort of pugilistic cover, but I think it sort of epitomizes that we were being stimulated from many sources. I have to say, some of them in this room. The participatory medicine movement, the rise of e-patients, and also the stimulation. I'd like to pay tribute to Victor Montori at the Mayo Clinic, who was on our editorial board, urging us to do more, to do better. So in an editorial that this cover is the front of, we talked about the many manifest problems facing healthcare. We're all familiar with them. Its fragmentation, its costs, the cost of it, the rising unsustainable costs of it, the poor delivery systems, and the worrying fact that the evidence base for much of what we do is sort of distorted by vested interests, commercial, political, and professional. And so we committed to advancing what we see as an absolutely crucial sort of patient revolution in healthcare. And we said the way we would do it was to set up a panel of patients to advise us on how we could kind of walk the talk in our own editorial processes and become much more effective advocates for change. So the vision has been, from the outset, was to try to promote partnership by becoming the change that we're advocating for in healthcare, and to publish research and new thinking and comment on the science and art of patient partnership. And if you go to our website, click on campaigns, this is the logo we've taken. It'll give you chapter and verse on what we've done, which is to try and embed co-production. Now, instrumental in this has been our close relationship that we've forged with our panel of advisors. And as I mentioned, there's several people in this room who are on our panel, which is 40 strong. Their names are up on bmj.com, and we continue to thank them for their provocation, for their stimulation, and for their insights on how we in the editorial office can do better. One of the most interesting things we've done, I think, is to require all authors of educational articles to work closely with patients and have them contribute and indeed co-author the articles they write with them, because it seems obvious, although I have to say it's come as a bit of a puzzle to some of our authors, that an article is going to be hugely better if it's informed by the patient's view of that illness, about what the burden of the illness is, the burden of the treatment is, and the things that enable people to live 24/7. What resources do they use? What networks do they draw on? And we've also started to send, and now we've got 18 months experience of sending our research papers out for review by patients as well as the usual peer reviewers. And to help us do that, we've built up a database of over 400 patients, and they are doing a tremendous job of commenting on papers for us. And I think the interesting thing is that editors, as we've begun to do this, have come around and said, gosh, the patient had something really insightful and different to say. It wasn't the same as the peer reviewers' comments. Well, surprise me. But anyway, the great thing is that all our research papers are freely accessible online. We're now putting all reviewers' comments up next to the paper, so you can judge for yourself, as more and more of our papers are going to have patients' comments on them next to the peer reviewers' comments. But I think one of the most important things we've done is to say to all the authors of research papers that we accept that you've got to state how you involved patients in your study. Right from the word go, did they help with the design, not just the design of the study, but actually formulating the research question? Then the design and implementation of the study. Did they choose the outcome measures? Did they help? Because that's what really matters to patients. And very often these are chosen by doctors, not by patients. So we don't know that the outcomes that matter to patients, and that is obviously crucial. And also patients want to be involved with the dissemination of research. And by getting people to actually state that and put it in a box, we're, I think, sending out a very clear signal, and it's totally in line with what funders like PCORI and the National Institute of Health Research in the UK about, who are attempting to really get patients involved in research, because we know there's a tremendous waste in the research effort, and that by involving patients, we will reduce that waste. We've got patients writing for us a lot now. We've got their fantastic blogs that they write, commentaries. They're involved with our multimedia streams, and we've got our marvellous patient editor, Rosamund Snow, I'd really like to pay tribute to, because she has literally picked the motes out of our editorial eyes. She's helped make us understand what partnership is and what it isn't, and she's doing a jolly good job with a lot of our authors too. She sits on decision-making committees and is a sort of provoking and stimulating presence, and it's great to have her time. One thing I'm particularly involved in is to also to make sure that our strategy is not, as in the past, a sort of like a silo. Oh, there's the BMJ business as normal, and oh, there's the patient bit. Because it's obviously integral to all the campaigns that we have around patient-centered care, about sharing records, about too much medicine, and about corruption in healthcare, which we're very concerned about, and another initiative that we're pursuing on high-integrity healthcare. Another strand of our initiative is to promote patients included in medical conferences. And I think it's a very interesting question to ask. At what level, do we have patients included? Is it only major conferences like this? Or is it small conferences within meetings? Is it in the context of multidisciplinary team meetings within the hospital where patients' voices are often excluded? But I think, we've been, well, I'm very inspired, I think, by MedX's example of successful participation by patients. And our aim is to draw up our own policy to get our act together with the conferences that we run ourselves, and to set requirements for those that we form media partnerships with. And we'll move to the position where we will only form a media partnership with conferences who do patients included. One thing I'd also like to mention, we've got this wonderful new series called What Your Patient is Thinking. And it's been written by patients, and they pull out from their experience what they think the learning points are for the doctors. So they are actually, educating the doctors directly, and doctors can read their articles and they can earn CME points from learning what matters to patients. And we've had some marvelous responses from some of them. They've been very widely hit, saying, gosh, it's made me really reflect sort of wincingly on my practice, and I'm going to change it. Okay, that's not a very hard outcome, but we know that we need to try to evaluate what we do, but I think it's very difficult in the context of the wide healthcare world, where there are a myriad, I think, of factors which are pushing this sort of patient involvement in healthcare movement. But we're encouraged by the positive feedback that we've had, and we think we're on the right track. But one thing we do know is that it's a joint endeavour, and that our success in achieving change is crucially dependent on us continuing to work closely with patients. And well, we'd like you to all be involved, and I'd sort of like to sort of extend a hand to all the patients here and all the doctors who are working closely with patients to try to promote patient partnership. Tell us what you're doing, because we would like to spread the word. Thank you.